I have the pleasure of being here with Dr. Rima Khabbaz, Director of the CDC National Center for Emerging and Zoonotic Infectious Diseases. Thank you for joining me today, Dr. Khabbaz.
Thank you. Thank you for having me.
So just to start off, we hear a lot these days about emerging and zoonotic infectious diseases. Can you describe what that means?
Yes, thank you. That's a good question. So emerging diseases are infections that have increased recently or are threatening to increase in the near future. Antibiotic resistance infections are a good example of this. And zoonotic means diseases that spread between animals and people. For example, Lyme disease, rabies, and salmonella infections are considered zoonotic. And protecting people from emerging and zoonotic threats is at the heart of what we do in my center, the National Center for Emerging and Zoonotic Infectious Diseases, or NCEZID. In addition to the diseases I just mentioned, we address threats like anthrax, sepsis, Zika, and so many others. And our scientists and researchers, as well as our laboratorians and emergency responders, are often ground zero when there is an outbreak of infectious disease. And in fact, we've been at the forefront of major disease outbreaks over the past few years, including the COVID-19 pandemic.
Mm-hmm. Thank you. So we've heard, a lot about emerging and zoonotic diseases in the last couple of months. But how does this translate to the average person? There's been a huge increase in pet ownership. People are doing a lot more outdoor activities because of the pandemic. What is the risk for the average person of acquiring a zoonotic infectious disease?
Well, I would say a lot of infections that we get actually are zoonotic infections. Estimates 6 of 10 infections are zoonotic. That is, they transmit between animals and people. And the whole range of infections that are in that categories.
Mm-hmm. So how could someone actually catch an infection from an animal?
So first, germs can spread to us through direct contact with animals or their body fluids. For example, when we pet or touch infected animals or through bites or scratches. Germs can also spread indirectly to us through contact with places where animals live or through contact with objects that have been contaminated with germs from animals. Aquarium tanks, chicken coops, or even pet toys and food or water dishes are some good examples. And people can also get infected through bites from mosquitoes, ticks, or fleas. And as well, we can also get infected by drinking or coming in contact with water or food contaminated by animals. And every year, we see many instances of people getting sick after eating contaminated food, which can often be traced to contamination from infected animals.
Mm-hmm. Thank you. So what is the role of your center, NCEZID, in combating these emerging zoonotic diseases, and in particular with regards to the COVID pandemic?
So, responding to public health emergencies is a critical part of NCEZID's work. We have been leaders in many outbreak response efforts. For COVID, I will tell you, in 2020, nearly 2,000 of NCEZID staff were heavily involved in the COVID-19 response, and many more are continuing to work today on the response. Our staff have worked in a variety of fields in the prevention and control of COVID-19, ranging from sequencing virus variants to diagnostic testing to vaccine safety, epidemiology, modeling, managing communications for the response, and many more. And several issues related to COVID-19 fall directly under our center's leadership, like healthcare worker safety, and travel health. Just some examples here. In fact, our Division of Global Migration and Quarantine has worked nonstop to help control and prevent the spread of COVID-19 among travelers and to stop importation of the virus to US destination communities, both critically important during this response. Just one example is the division's work to help control COVID-19 spread on cruise liners. And last year, CDC and the Coast Guard helped evacuate over 40 cruise ships, helping more than 260,000 passengers safely disembark. This is the first ever no-sail order that was issued for the industry.
Yeah, so thank you and your staff for the incredible work at this time. What would you say has been the biggest challenge for your group during this pandemic?
Well, the scale of this pandemic is unprecedented, right? I think the biggest challenge to all of us is that it's a response where what we're working on is what we're living. It's have affected everyone, every community, and it's just been both in terms of scale and the demands on staff 24/7 while they have issues, dealing. The pandemic is affecting them and their families and their communities at the same time. We haven't seen anything like that previously.
So I know that while we're still in the throes of this pandemic, it's difficult to look beyond it. But if you had to, what would you say you see coming up on the horizon?
So, well, first, I would say the response to COVID-19 is going to continue for a while. So that's still with us and in the horizon. The nature of this pandemic and the response to it have already taught us some lessons. And we have, during COVID-19 and after, we've continued to address ongoing threats, right? So it's not been just COVID. We've had outbreaks of Ebola. We had 2 outbreaks that we dealt with in the DRC, followed by another 2 outbreaks, one in DRC and one in Guinea that we've been responding to, as well as we have issues of climate change, and we have antibiotic resistance that with us. So these are among the biggest public health threats we face today, and I think will continue to be a priority for us after COVID-19, the pandemic ends. And also, I think some lessons from COVID-19 will also help us hone the way we approach both new and ongoing disease threats in the future.
Mm-hmm. Yeah, you mentioned Ebola and other diseases that thankfully are still somewhat regional. And you mentioned the lessons learned. So how do you foresee taking those lessons to kind of optimize your approach to the next pandemic or public health crisis, really?
Right. Well, thank you. Yes, the next crisis is always around the corner, right? So it is critical to our national security and to the lives of Americans that we learn from the pandemic. And one of the main lessons is to build a strong public health infrastructure. Preparing for infectious disease threats is among the most critical activities at NCEZID, and we do this in many ways. We have disease detective among the experts, among our top experts in some of the most dangerous pathogens in the world. I mentioned Ebola, plague as well. And we work directly with others at CDC and partners to prepare for outbreak events. Some of this work includes improving our diagnostic, developing diagnostic tests, updating clinical guidance, and many other things. We also oversee the high containment labs at CDC, and we manage the lab response network of more than 120 labs that respond to public health emergencies. These include naturally occurring ones and acts of bioterrorism. So these are just a few preparedness examples that we engage in. And we continue to enhance our efforts. And as we learn lessons, we are focused on improving our capacity to respond to threats, not just at CDC, but also on the front lines at state and local health departments and with global partner countries and regions.
Yeah, that's an interesting point. Would you say that this pandemic has accelerated the development of certain diagnostic technologies and approaches that might not have otherwise happened?
There's no question that I think the response to the pandemic has benefited, right, from technologies and science that had not been available to us. One example is in the vaccine area. 2 or 3 vaccines we use, mRNA vaccine, are exactly that. I think it's been science. I'd say that the pandemic, to get that related, there's a lot of work that had been going on in the science to get us here. We benefited from. I think going forward, all those technologies are going to be very helpful as well for the sequencing work. We had engaged on developing that capacity and public health and integrating it into public health. And definitely the pandemic has brought to the forefront the importance of sequencing and and the need to do more in this space.
Yeah. I definitely agree. I think the growth of sequencing, not just in public health, but even in clinical labs, will benefit all of us in improving our understanding of infectious diseases. So along those lines, even though the pandemic is what's in the news and what's foremost in our minds, there's a lot of other diseases that continue to circulate, continue to cause harm. And to some extent, it might seem like that they're being ignored to the detriment of those who suffer from those diseases. So what do you see are the ongoing emerging threats to the general public?
So we continue to respond to several ongoing threats that are among the biggest public health problems we face today. And let me just touch on a handful. One of the major health issues we're fighting today is, and I've already mentioned this, is antibiotic resistance, right? Antibiotic resistant bacteria and fungi kill more than 35,000 people every year in the United States. And even though CDC and our partners, other organizations, have helped tamp down these infections since 2013, some resistant pathogens are on the rise, and we are working hard to address them in multiple ways. So that's one. Second, I would mention is the reemergence or re-emerging threat of Ebola. Our center has been addressing almost nonstop since 2014 Ebola outbreaks in Africa. And in 2020, we supported efforts to stop 2 Ebola outbreaks in DRC. And one of which was the largest or the second largest for DRC and the second largest Ebola outbreak ever recorded. And then we had 2 outbreaks following that, one in DRC and one in Guinea. And as of now, late April, response activities continue in both countries. And I'm happy to say that end of March, the last patient in DRC was discharged from the Ebola treatment unit, testing negative, which started the country's countdown, the end of the outbreak, and which is 42 days, right? 2 incubation periods of the virus that must pass with no new cases following the survivor's discharge from the outbreak. Then we can say the outbreak is over. And in Guinea, just this weekend, the last patient was discharged. So the countdown is just starting. So we continue to support response works in those 2 countries and in surrounding countries as well, to get them prepared for that. And on the home front, we continue to face threat from emerging foodborne diseases. Number of salmonella outbreaks and other foodborne outbreaks, and as well from vector-borne diseases like Lyme diseases and others. So the threat continues.
Thank you. Yeah, and I think it goes back to your original point about sequencing and really the huge benefit that will give us with regards to especially antibiotic resistance bacteria, which is an emerging threat for this country and really worldwide. Mm-hmm. But with so much going on, how does your center decide to prioritize the threats facing people today?
With emerging diseases, you really don't know what the next threat is going to be. So you have to be prepared across the board. And in our center, we look at scientific research and epidemiology to determine what diseases could present the biggest threats. And so when an event has a potential to become a bigger outbreak, we prepare, like I said, broadly across the board. We also assign threat levels not for diseases, but that's when we have a threat develop. For example, we issue travel health notices when we have a threat somewhere. And in our center, the Division of Global Migration and Quarantine helps determine when a travel health notice is necessary and what level it needs to be based on the situation. So we have at CDC 3-level travel health notice system. Level 1 means just practice usual precautions if you're going somewhere and there's a disease threat. Level 2 means practice enhanced precautions, so the usual plus, right? So usual precautions or plus. And level 3, when we issue it, it means avoid all non-essential travel is what we recommend. For example, currently we have a level 3 travel warning for the countries of Guinea and the Democratic Republic of Congo because of Ebola. And for COVID, on November of last year, November 21, 2020, we adapted this 3-level notice system to a 4-level system for COVID-19. And we updated the criteria used to determine the travel health notice levels. So this 4-level system for COVID-19 characterizes destination, including international destination and U.S. territories in the following ways. So level 1, meaning all travels should take everyday precautions, wear a mask, stay 6 feet from others, avoid crowds, and wash hands frequently. Level 2 means if you're a traveler at increased risk of severe illness from COVID-19, then we would recommend avoiding non-essential travel to those destinations. And level 3 means for everyone to avoid non-essential travel to these destinations. Then level 4 means we recommend avoiding all travels to these destinations. And as many of you know, CDC often assists in public health emergencies through our Emergency Operations Center, or EOC, which we activate. And we have 3 different levels of EOC activation based on a scale of event, with level 1 being the highest level, requiring our staff to be there working 24/7 to support agency-wide efforts. And so the EOC has been activated at level 1 for several responses, including Ebola in 2014, Zika in 2016, and most recently for the COVID-19 pandemic. And in all of these activations, our center and center staff have played a major role.
Thank you. That's really interesting. Can you touch briefly on the data and the information or the sources of information that you use to come to these determinations as to the criteria level for a particular threat, especially when it's worldwide and you're dealing with different sources of information?
I'm sorry, I didn't get the question.
Oh, what sources of information do you use to determine, to assess the threat level in making these distinctions?
We look at all kinds of data. There's data that we have through surveillance system, data that we have from partners, from other organizations. We look at a lot of data combined, as well as information how we get to and the situation is often with the threat evolving, right? So we assess and reassess and figure out what is going on and the scale of what's going on, and anticipate what might spread and what might happen. So all kinds of data, CDC and partners data, and sometimes news stories, just everything.
Right. Yeah. Thank you. So we've heard more and more about, the change in weather patterns and climate across not just the US, but the world. We've heard about vectors that transmit pathogens moving into areas that they previously hadn't been found before. How are you, what is the role of your center in this crisis, and how are you acting in this area?
So, yes, thank you for the question. Climate trends directly affect health, Americans' health and others' health, and extreme weather events are happening with increased frequency and intensity. And climate also affects the relationship between animals, vectors, microbes, and the environment. And like I said, given our focus on emerging and zoonotic infections, I will say we are seeing more changes in zoonotic diseases that are connected to the environment, such as Lyme disease and other tick-borne illnesses like Rocky Mountain spotted fever. Another example is rabies, zoonotic infection that also, the interactions with animals are affected by that. We have in my center a One Health office that works with partners across the globe to promote the concept that the health of people is closely connected to the health of animals and our shared environment. And this approach is not new, right? But it has become more important in recent years and has a major impact on how we detect and respond to disease threats by making the connection and making sure that our work cuts across sectors, both in terms of detecting and responding to the threats. Let me give you a few examples of what we are already doing to address threats related to climate change. In 2016, our center launched a reporting system designed to collect information to help us better understand harmful algal blooms and ways to prevent associated illnesses. And in 2020, we provided $850,000 across 9 jurisdictions to help state health officials address concerns about harmful algal blooms. We also provided technical assistance to jurisdictions and are planning to provide additional funding again this year to address the threat from harmful algal blooms. Another program I will mention, we have an Arctic investigation program up in Anchorage, Alaska, and they work tirelessly to identify and reduce risk factors for infectious diseases among residents of the Arctic and subarctic regions. And the work they do is crucial now more than ever because Arctic temperatures are rising more than twice as rapidly as the rest of the world, causing a global impact and a lot of big effects on Arctic ecosystems and communities. So, like I said, they're based in Anchorage and they work very, very closely with partners there to conduct climate-related health surveillance and research. And one example is a new working group that they formed with the Alaska Native Tribal Health Consortium to better understand and respond to health issues that are connected among people, animals, and the environment. So this group is going to be help Alaska Tribal Health System colleagues understand and respond to health related to climate change. And I should also mention our division of vector-borne diseases. You mentioned that, and I mentioned Lyme. We're working with them on several fronts to prepare the nation for the effects of climate change. We are committed to building a national infrastructure that advances innovation and builds programs with a mission of reducing illness and death from vector-borne diseases that are increasing and expanding a lot as a result of climate change.
That's fascinating. Thank you for the work you do in that area. But one last question. You mentioned national infrastructure. Does that involve the public health labs as well as clinical labs? How do you foresee the development of that national infrastructure to monitor these changing patterns of diseases?
So, for vector-borne diseases, that national infrastructure will be all-inclusive. One is having vector control programs in states and jurisdiction, as well as improving the surveillance effort to detect vector-borne diseases and to detect infections, to be able to monitor tick expansion of ticks to new geographic areas and then tick harboring disease. So that's in the public health, working with state and local health departments, as well as academia, supporting the development of new tests so that we can have innovative diagnostic tools for the diseases that we work with. and novel interventions, right? We have lots of insecticide resistance, and I think our toolbox is limited, but there's some exciting science that we think can help in that lane as well. So yes, the whole range of academic as we develop new tools and diagnostic, then the clinical community with guidances, and the public health infrastructure are all part of that plan.
Well, that's really fascinating. Thank you, Dr. Khabbaz, for the work that you and your group does behind the scenes and on the front lines. And thank you again for taking time to speak with us today.
Well, thank you. Thank you for the opportunity to talk with you today. Appreciate it.